Parkinson's disease is the second most common degenerative disease of the nervous system after Alzheimer's disease. The main features of Parkinson's disease are tremor, shaking of the body, rigidity, the body becomes stiff, and bradykinesia. There is a slowness of the movement. These are the cardinal features of Parkinson's disease. Is a disease which starts about the age of 60 to 65 years, and we use the word idiopathic Parkinson's disease. Well, tremor and Parkinson's, it's the same thing in the sense that the main feature of Parkinson's disease is a tremor. But the tremor could be because of a number of other causes. But as I said, that the cardinal feature of Parkinson's disease is tremor. So that's why the patient lands up with the neurologist and is investigated and seems to be suffering from Parkinson's disease. When the case study is that this is a gentleman who has Parkinson's disease, and he was on a number of anti-Parkinsonial drugs. In spite of his being on the drugs, his disease was not getting controlled. And on top of that, he was getting side effects of the drug. So when we had a patient who was not responding to the drugs for Parkinson's disease, we had to offer him something else. This procedure, what we do is called DBS, the full form being Deep Brain Stimulation, which means that we stimulate the deeper structures of the brain from where the disease originates and correct the symptoms and corrects the interplay of the current in that area so that the patient's symptoms improve. I must be very clear, even by drugs or by DBS, we are not curing Parkinson's disease. We are only controlling the symptoms of the disease. See, there is no role of that, but there's certainly a role of good amount of physiotherapy, and more than that, the regularity of medicines. Well, everything has pros and cons. After all, you are putting a stimulator in the brain, you are connecting it outside, there can be infection. If you are not stimulated the right place, you will be in problem. There can be problems of the hardware, there can be problems of you are not making the right target. So there can be problems, but you can cause some hemorrhage in the brain. But they do occur in a small percentage of patients. But one has to be aware that it is not a procedure without complications. Every procedure that you do is going to have some complication or the other. But in our own experience, the procedure does very well. It improves the quality of life in 70% of the patients. Patients who are called Parkinson's plus, where the Parkinson's symptoms are the representation of an underlying degenerative disease. So these are the types of patients where nothing helps and they have gross degeneration of the brain and they continue to deteriorate over a period of time.
Apollo is a very, very clean hospital. The people are very, very kind. The international launch is actually assisted us a lot in placing us in the right places. And we came and saw Dr. Tyagi, a very, very good doctor. In Kenya, the doctor will just talk to you. Sometimes he does not consult with other doctors, occasionally because of maybe the number of patients. But when Dr. Tyagi saw his case and said, we will refer you to Dr. Renjen. Dr. Renjen is a very humorous person, full of love. His humor alone will give you healing. So we really appreciate you. I think you are in the right profession. And even the happiness, as most people, when you talk to them nicely, you give them that saying, you are okay, you will be well, they get well very fast. And we really appreciate you. You are in the right position. You have a calling. You have divine hands which are for healing. You have changed his life. And you gave us that hope that, hey, this one is not a case. We are going to deal with it. It's not a problem.
The DBS, the full form is Deep Brain Stimulation. It means we are stimulating something in the deep part of the brain. That particular thing in the brain is a particular group of neurons which we call nucleus. These nucleus are important in movement coordination. When a person is doing movements, there's something, the order comes from the brain, and the coordination of the movement occurs because some neurochemicals are secreted from one part of the brain of the particular nucleus, which reaches to another part of the brain and stimulate that part. When some neurons stop working, stop secreting that neurochemicals, then the person is having movement disorders like Parkinson's disease, like essential tremors, dystonias. When we are trying to stimulate that particular nucleus, we are trying to correct that deficit of the neurochemicals. DBS can last forever because earlier we were having the batteries which were having the limited time, like they work for 6 years. After 6 years or 7 years, we have to change the battery. But now we have the batteries which are rechargeable. So this is a kind of neurological pacemaker which is working whole life. The person can charge it from outside, no need to change it. So once the DBS has been done, it will work for the life. See, the Parkinson's disease or movement disorder, the problem is the quality of life. If a person who is not at all working because of this disease, he is losing the money every day. The person who is taking medicine every day, plenty of medicine, but they are not helpful. Person is not getting any benefit. The disease is not getting controlled. Then that is also loss of the money. DBS is an expensive device if you see in the Indian scenario, and the cost is about 15 lakhs total cost of surgery as well as the device. But if you see, compare it the cost which the patient is losing because not working and the cost which he is losing because he is taking so many medicine without any benefit. So it comes out sometime, I think, quite reasonable. The ideal case study is because the patient who has been to the physician initially diagnosed Parkinson's disease or movement disorder, then after diagnosis they reach to the neurophysician, and number of years they keep on taking medicines, and after that the effect of the medicine start getting wear off and the side effects are more and more with the time, and the dose of the medicine is increasing every year. With this, the patient ultimately becomes the bedridden patient, and the whole family is trying to help that patient. The person in the family are not going to work because they have to help one person in the family, the elderly man. So these patients are the good candidate for the deep brain stimulation. So when they reach to the neurophysician, they say that this patient is not getting benefited with the medicine. These patients are referred to me for the surgical benefits, that is deep brain stimulation side. The challenge was when I was trying to target the different part of the nucleus, I was not getting the proper recording. That is, on the microelectro recording, we should get the biphasic wave when we are at the right place. In this particular patient, I was getting the biphasic wave, but they were very, very weak. So I was trying in the 7 to 7 millimeter size of the nucleus, I was targeting different part of that nucleus to get the best of the microelectrode recording. That will tell me that I am at the right place. This is the place, if I stimulate, the patient will get benefited. So it took me a little longer time as compared to other patients.